The complexities of gambling addiction. Gambling addiction, also known as pathological gambling, has been recognized as a significant issue that shares many similarities with substance use disorders. According to research by Anna Thomas and Gemma Mestrebach, gambling can become addictive due to commonalities in its etiology, clinical presentation, and high comorbidity with substance use disorders. This means that the underlying causes and symptoms of gambling addiction often mirror those of drug or alcohol addiction. Furthermore, individuals who suffer from gambling addiction frequently experience other mental health issues, making it a complex disorder to address. Anna Thomas, in her research titled Gaming Marking Addiction, The Role of Avoidance, Accessibility and Social Support, has delved deeply into the motivations that drive individuals to develop gambling problems. Her research highlights that motivations such as avoidance or social reasons significantly contribute to the onset and progression of gambling addiction. For example, some individuals may turn to gambling as a way to escape from stress or emotional pain called avoidance motivation. Others might gamble to fit in with friends or to enjoy the social aspects of gambling environments or social motivation. These motivations are not formed in a vacuum. They are often influenced by situational life stresses, existing coping habits, and the level of social support an individual receives. Situational life stresses could include financial difficulties, relationship problems, or job-related stress. When people lack healthy coping mechanisms to deal with these stresses, they might turn to gambling as an outlet. Additionally, the presence or absence of social support can play a crucial role in either exacerbating or alleviating gambling behaviors. Those with a strong support network may find it easier to resist or recover from gambling addiction, while those without such support may struggle more. Mevludin Hasanović in his research emphasizes that a loss of control is a central aspect of gambling addiction, much like it is with substance addictions. In substance addiction, individuals often find themselves unable to stop using the substance despite knowing its harmful effects. Similarly, those addicted to gambling continue to gamble despite the negative consequences it brings to their lives, such as financial ruin, strained relationships, and emotional distress. Hasanović also points out that gambling addiction is categorized as a behavioral addiction, which is a relatively new and revolutionary concept in psychiatry. Unlike substance addictions, which involve physical dependence on a drug or chemical, behavioral addictions involve compulsive behaviors that provide a psychological high. This new understanding has led to greater recognition of the need to address gambling addiction with the same seriousness as substance use disorders. Sophia Achab's research titled Gambling Addiction, an overview of conceptual, neurobiological, and clinical aspects provides valuable insights into the comprehensive treatment approaches necessary for addressing gambling disorders. Effective treatment must tackle several key components: gamblers' fallacies, cognitive biases, psychotherapy, and debt management. Gamblers' fallacies are erroneous beliefs about gambling, such as the idea that a win is due after a series of losses. These fallacies can perpetuate gambling behavior, as individuals continue to gamble in the misguided belief that their chances of winning will improve. Cognitive biases refer to patterns of thinking that skew one's perception of reality, often leading gamblers to overestimate their chances of winning or to minimize the risks involved. Addressing these fallacies and biases through education and cognitive behavioral therapy, CBT, can help individuals develop a more realistic understanding of gambling, thereby reducing their urges to gamble. Psychotherapy, particularly cognitive behavioral therapy, plays a crucial role in treating gambling addiction. CBT helps individuals identify and change the thought patterns and behaviors that contribute to their gambling addiction. By addressing the root causes and triggers, Therapy can equip individuals with healthier coping mechanisms and strategies to manage their urges to gamble. Group therapy and support groups can also provide valuable peer support and shared experiences, fostering a sense of community and understanding. Financial problems are a common consequence of gambling addiction. Many individuals accumulate significant debt due to their gambling habits, which can exacerbate stress and perpetuate the cycle of addiction. Effective treatment must therefore include financial counseling and debt management strategies. This might involve creating a budget, negotiating with creditors, and developing a plan to repay debts. Addressing the financial aspect can reduce the immediate pressures that drive gambling behavior, allowing individuals to focus more on their recovery. Anna Thomas further elaborates on the relationship between gambling, stress, and coping mechanisms. According to her research, situational life stresses and general avoidance coping are positively related to avoidance-motivated gambling. In other words, individuals who experience high levels of stress and who tend to avoid confronting their problems directly are more likely to turn to gambling as a way to escape. This avoidance-motivated gambling, in turn, is positively related to the frequency of electronic gaming machine, EGM, gambling and associated problems. Thomas's findings underscore the importance of addressing underlying stress and developing healthy coping strategies as part of a comprehensive treatment plan. By helping individuals manage their stress more effectively, therapists can reduce the reliance on gambling as a coping mechanism. Gemma Mestrebach in her research highlights the progress made in understanding gambling disorder and its treatment. The increase in empirical evidence has allowed researchers and clinicians to better understand the pathology of gambling addiction. This improved understanding has led to the identification of common comorbidities, such as anxiety, depression, and substance use disorders, which frequently co-occur with gambling addiction. Recognizing these comorbidities is crucial for designing effective therapeutic interventions that address the full spectrum of an individual's mental health needs. Sophia Achab's work emphasizes that a holistic approach to treatment is essential. This approach not only targets the cognitive and behavioral aspects of gambling but also provides practical support for financial issues and addresses any co-occurring mental health conditions. Comprehensive treatment programs that integrate multiple therapeutic modalities and support systems are more likely to be successful in helping individuals achieve long-term recovery. In conclusion, gambling addiction is a complex disorder influenced by various factors, including motivations for avoidance and social interaction, situational life stresses, and coping habits. The loss of control over gambling behavior mirrors the patterns seen in substance addictions, highlighting the need for a comprehensive approach to treatment. Effective treatment strategies must address cognitive biases and gamblers' fallacies, provide psychotherapy, and offer support for financial management. The research conducted by Anna Thomas, Gemma Mestrebach, Mevludin Hasanović, and Sophia Achab collectively enhances our understanding of gambling addiction and its treatment. By acknowledging the multifaceted nature of this disorder, we can develop more effective interventions and support systems to help individuals overcome their addiction and lead healthier, more fulfilling lives. As our understanding of gambling addiction continues to evolve, it is essential to keep advancing research and refining treatment approaches. By doing so, we can better support those affected by gambling addiction and mitigate its impact on individuals and society as a whole.